In this video, we will show you how to store and administer the AstraZeneca COVID-19 vaccine. First, a few basic facts about the vaccine. The AstraZeneca COVID-19 vaccine comes as a liquid, preservative-free suspension in a multi-dose vial. The number of doses per vial varies depending on the vaccine manufacturer. Vaccine manufactured at SK Bioscience contains 10 doses per vial, while the vaccine manufactured at Serum Institute of India contains either 2 or 10 doses per vial. No dilution is required. This vaccine is ready to use. The vaccine is administered in 2 doses, with the second dose given 4 to 12 weeks after the first dose. WHO recommends an interval of 8 to 12 weeks between the doses. In clinical trials, the vaccine given in 2 doses was shown to be 63% effective, with higher efficacy when the interval between doses was longer. The route of administration is an intramuscular injection in the upper arm. It is currently recommended to be administered to people who are 18 years of age and older, including those above 65 years of age. Let us review how the vaccine should be stored. Store the vaccine in the original outer carton to protect from light. While the vials are in storage or taken out for a vaccination session, avoid exposure to direct sun or ultraviolet light. Store unopened vials in a refrigerator between 2 and 8 degrees Celsius until the expiry date stated on the label. The expiry date on the label of this vaccine is given as a month and refers to the last day of that month. Do not store the vaccine in a freezer. It should not freeze. While in use, also keep the vaccine between 2 and 8 degrees Celsius. Discard any unused vaccine in the vial 6 hours after the first dose has been withdrawn or at the end of the immunization session, whichever comes first. Now, let us talk about how to prepare the vaccine for administration. Again, this vaccine is ready to use and does not need to be diluted. Do not shake the vial. Inspect the vial to make sure the liquid is clear to slightly opaque and colorless to slightly brown. If visible particles or discoloration are present, do not use. Discard the vial. On the vial label, write the date and time of first use. The first use is when you first puncture the vial and withdraw the first dose. Next, draw up a 0.5 milliliter dose into the AD syringe at the time of administration. Preloading of syringes is not recommended. Administer the vaccine into the upper arm of the recipient using an intramuscular injection technique. Follow safe injection practices to avoid any needle stick injuries. Dispose of used syringes in a safety box immediately after vaccine administration. There may be some vaccine left in the vial after you withdraw the final dose. Discard the vial. Do not combine remaining vaccine from multiple vials. Discard opened vaccine vials 6 hours after first puncture and dose withdrawal, or at the end of the immunization session, whichever comes first. Ask the vaccine recipient to sit in the waiting area for observation for at least 15 minutes after the injection and encourage them to complete the vaccination series. You should now know how to store and administer the AstraZeneca COVID-19 vaccine.